Approximately, there are 5 million dental implants are placed worldwide every year. According to the 2017 World Workshop Consensus Report, and that's reported by Berglund et al. 2018, they emphasized that peri-implant disease are expected to become much more prevalent in the next following years. Why is that? So it's due to a number of factors. Number one, that we place now more implants every year, so increase in the implant placement annually. Number two, aging populations, which basically our age expectation is higher than it was 20 to 30 years ago. And also patients now are retaining implants for longer periods. So now let's dive into what is peri-implant disease. So peri-implant disease, we have peri-mucositis and we have peri-implantitis. So I'm going to start with peri-mucositis. So peri-mucositis is an inflammatory reaction of the soft tissue surrounding the implant. So we're talking about an inflammation in the peri-implant soft tissue or mucosal seal without any supporting bone loss. So how can we detect this clinically? So we see redness, swelling, bleeding and probing, but no radiographic bone loss. There's something very important that you have to always go back to your initial radiographs to assess your initial bone remodeling following implant placement. Now, in contrast, peri-implantitis involves both inflammation of the peri-implant mucosa and also progressive bone loss beyond the initial bone remodeling that follows implant placement. The 2017 World Workshop Consensus Report provides clear definition and a diagnostic criteria of the peri-implant disease. So what is this diagnostic criteria? Peri-implantitis is characterized by bleeding or separation and probing, or both, increased probing depth compared to previous measurements, and radiographic bone loss beyond the initial bone remodeling. That is why it's so important to always follow up on your patients and take radiographs and clinical measurements every 6 months to 1 year, so you always go back to your previous investigations. Now, what is the prevalence of peri-implant disease? Studies indicate that peri-implant mucositis occur in up to 80% of patients with implants, while peri-implantitis affects roughly 20% of patients and 10% of implants over time. The next question, which is, how can we manage peri-implant disease? The best way to manage peri-implant disease is to prevent peri-implant disease from happening. And that's by precise placement of your implant with very good bone surrounding your implant, very good tissue seal, and good patient selection, and very important to educate your patients about their oral hygiene and long-term maintenance of their implants. However, sometimes peri-implant disease is unavoidable, so we have to know how we can treat them when the patient come to us for treatment. So peri-mucositis, usually with mechanical debridement with ultrasonic scalers and your titanium curettes, along with antiseptic rinse such as chlorhexidines, can be effective to treat your peri-mucositis. Again, educating the patient about the oral hygiene is so important for the long-term maintenance of your treatment. For peri-implantitis, it can be much more complicated, so non-surgical therapy, sometimes it can be effective, it can control the inflammation. However, surgical intervention, including open flap debridement, resective surgery, regenerative procedures, sometimes it needs to be done around implants with peri-implant disease. Case selection is so important in these cases, so you're not going to be doing, for example, a resective surgery or removing a huge amount of bone, and patient can end with a recession and an implant in the aesthetic zone. So it's so important to always see what is the patient expectations, where this implant or the situation of the implant, and where this implant is placed. Is it a posterior implant, anterior implant? Oh, hello there! If you want to know more about evidence-based insights in periodontics, don't forget to subscribe to our channel, Healthy Gums Dentist or Keystone Periodontics, on Instagram, YouTube, or on Facebook page.